Surrender line 7924 control site. Please welcome.
Good morning to everyone present here. I am very delighted to be standing in front of you. My paper is a non-competitive category as all the papers which were there in the morning. I am from Customer Medical College, Bangalore, Manipal University, presenting my research report on immediate effects of the Mulligan's mobilization with movement or passage and asymmetry and mobility in asymptomatic subjects. I greatly acknowledge it. Just please hold on. I want this. What is happening here? I tell you next. Okay, then you move. Okay. Thank you. I greatly acknowledge the scientific committee for approving my paper and the organizing committee for their encouragement, the chairperson, judges and the delegates, all of you who are sitting here in the morning, and my HOD, especially my two co-authors, my dear third PPT student who performed the study, and the intern who volunteered to be the model, everyone, and my patients who are my continuing inspiration. Next. Introduction. Mechanical lobar pain has been increasingly been identified in the clinical physical therapy scenario, and the role of facet joints being the source of symptoms in mechanical lobar pain have been identified. And facet joint dysfunctions are common either in the neutral position of the spine or in non-neutral position of the spine. The non-neutral position of the spine dysfunctions are classified into type 1 and type 2. The neutral one is type 1 dysfunctions, non-neutral is type 2. In the non-neutral, dysfunctions can occur either in flexion of the spine, dysfunction can occur also in the extension of the spine. The two types of facet joint dysfunctions. The dysfunctions could predispose the person to a degeneration. Degenerative cascade can come, after that instability can come, then we can get fixed in a stabilization phase, according to Patiala village. This dysfunction may not lead to symptoms in everyone. It's the earliest phase, what happens to the facet joint. Where some authors propose the tropism, developmental orientation of the facets to be the cause for the dysfunction. Other authors propose the mechanical cause, because of the habitual postures and asymmetry between the right and left. And various treatments have been proposed, right from ranging from local ultrasound to exercises. Nanotherapy, especially addressing the facet joints, Syriac proposed facet joint injection and manipulations, high velocity techniques, muscle energy techniques, and also Maitland said about unilateral posterior pressures. Recent, the Mulligan's mobilization with movement was proposed for facet joint mobilization. He referred to central technique as central posterior pressure, where you combine accessory mobilization with the physiological mobilization. That is, when the spine is actively moved or passively moved, together with the physiological movement, you apply the pressure towards the glide. And he said it has sympathoexcitatory effects, and because of the mechanistic occurrence being desensitized, the patient gets immediate relief of symptoms and restoration of function. Next slide. Review of literature, one study which I could identify on the Mulligan flexion mobilization with movement. Okay, they have given the mobilization in flexion of the patient. And they compared in the low back pain patients, compared versus placebo intervention, and they studied the immediate range of motion and the pain outcomes. And they found that pain improved, but not the range of motion in the subject. And both of these improvements are only clinically significant, not statistically, because of the small sample size. It was reported in the Journal of Management and Physiological Therapeutics. So the current problem what we have now, next slide, is there is no study actually studying on the facet joint symmetry. Okay, asymmetry, if there is anything between the facet joint, between side to side, can be restored there to restore normal balance in the body, and facet joint mobility, the effect of the mobilization with movement. Next. Purpose of our study is to study the immediate effects of the Mulligan mobilization with movement on the facet joint asymmetry and mobility in asymptomatic subjects. Next. We hypothesized that the Mulligan mobilization with movement will be more effective than the placebo intervention in improving the facet joint symmetry and mobility in the asymptomatic subjects. Materials and methods. Study design is a randomized, double-blind with the tester and the observer blinding, and it's a placebo-controlled study. Study setting was an outpatient treatment unit of the Department of Physiotherapy, Customer Medical College, Bangalore. Study duration was 2 months, May and June 2007. Subjects were 40 subjects, 32 females and 8 males. Age group 21 plus or minus 2 years. Inclusion criteria, they should have a positive quadrant test, right and left. When you do the quadrant test, they should have symptom of localized pain. They would not have symptoms before. They should be asymptomatic, but when you are doing the testing, they will be showing the positive sign. And then during the facet joint asymmetry, it's rated on palpation. So during that palpation, the asymmetry between right and left. type 2 dysfunctions which is non-neutral, flexion or extension occurs only at one level. Type 1 neutral dysfunctions occur at multiple levels, which is for you. Excluded patients were either having a present or past history of NOPAC or low extremity symptoms. Right. Tester, the primary testers were the two third-year DPT students under the guidance of the Asst.Prof. And all the testers underwent a period of habituation and training for the period of 3 months to go ahead with the techniques and the reliability, to improve the reliability between the testers for the palpation and also for the treatment technique. Blinded observers measured the outcomes pre and post, only once. Testing instruments, two tests, quadrant test, positive and negative responses, method joint asymmetry, positive or negative, which side, right and left. So quadrant test, extension, right lateral flexion, right rotation, left side quadrant test, extension, left lateral flexion, left rotation. Next. Palpation for the asymmetry in the facet. Flexion asymmetry for the facet in flexion is found if patient is sitting where he bends between his feet. Examiner palpate for case facets. Next one is neutral, where the patient is in prone, and examiner palpate for the level of the facet, which is more posterior, which is more superior for the figure. Palpation for the facet asymmetry in extension, where the person is instructed to be on chin on elbows, or the thin position. In that position, again, palpation is done. And about the palpation, the subjects who are having flexion dysfunction will show asymmetry in the extended position. And the subjects which are having extended dysfunctions will show asymmetry in flexion. So try to find out what was the dysfunction and then direction of mobilization was given accordingly. So those who are having flexion dysfunction, that means it's the asymmetry in extension. So those people are given extension MWM, mobilization is movement. Okay. So total subjects contacted were 72, and after the exclusion we had 40, and then we did block randomization to achieve equal sample size. Next. MWM position quadruple. Next. In flexion, when the pressure will be applied to the articular process during flexion. Next. Again during extension. Next. Intervention placebo for the control, MWM for the experimental. Next. Corrected only once. Next. Analysis was done during the non-parametric testing. Next. Results. Next. Both the groups improved, but the malignant group improved better, and especially the asymmetry was found more on the right side, vertical asymmetry, and it was more in the extended position, that is flexion dysfunctions. Next. 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 Our study has a high internal validity because of the blinding and the randomization. However, external validity is limited because we did not only on high asymptomatic subjects, it's not on the painful subjects. Age group was also very narrow, so we have our own limitations. Future studies could be done with better outcomes, more reliable like diagnostic ultrasound to detect what is happening during the MWM. Okay, is the asymmetry present or it is changing during the MWM? So there is always scope for further studies. Next. So we have to conclude next that the malignant MWM group improved better in the immediate response with respect to the lumbar facet joint mobility and asymmetry than the placebo group. Next. I am thankful to the authors for their wonderful references for the studies. Next. 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 Most important, the last thank you, where I am extremely privileged to be standing in front of you and present this research report. And I am extremely glad to be in this international conference of physiotherapy meeting all you wonderful delegates. And I really enjoyed the stay here. And I am thankful for the organizing committee also for that. Thanks to everyone. Next. Again. Thank you.
I think you will come with a remedy for those people who are suffering from backache and everything. Really good paper, research oriented. Thank you. Any questions?
Because the subjects are asymptomatic, we only wanted to see the immediate response. If they had symptoms, we would have chosen for other therapies to be given as a nudging. So only the technique, which is in the quadruple position, where during the movement the patient shifts anterior, that time which goes with the extension, that time the pressure is applied to the vessel. And during the flexion, when the subject drops backward in the quadruple position, we can obey this with the flexion. Placebo one is simple prone line with a verbal reinforcement to the patient saying that your position will relax the muscle and restore the joint position, and you might have a better response after the test, so that they will cognitively expect some improvement and under the supervision of the therapist. So placebo was and the other one.
Any more questions? Okay, thank you.
Thank you, sir. Thank you, sir.